You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. Smile makeovers. With us, we have North Carolina's go-to cosmetic dentist. We've had him on the program before, Dr. John Highsmith. Dr. Highsmith, welcome to the program.
Thank you. Glad to be back.
And we should mention, you wrote the book on cosmetic dentistry.
There
right?
we are.
Love Your Smile, Change Your Life. You really think it is life-changing?
Oh, absolutely. I see it all the time by what people tell me after we restored their smiles and made them beautiful. And people tell me stories about, what their life is like, what is different about their life after that.
Okay.
And it's amazing what we can do for people.
Who's the typical patient that comes in for cosmetic dentistry?
Well,
porcelain veneers.
Okay. Well, everybody's different, but a common thing we see is where the teeth are worn. They're
Okay.
just kind of like the edges are kind of flat, and that basically sends the message that it's old. Nobody wants old looking.
So
smile.
flat teeth are
flat
old
teeth
looking.
They send the message that you're old, even
Okay.
though you're not. Because I've had patients in their 20s and 30s where they've worn their teeth down, and it makes them look older than they are, and they hate that. And so when you're doing this, it's very important to not only put the edges back, but get the bite correct so they don't wear them down again. Because they got worn for a reason, and so we not only want to make the smile beautiful, but we also diagnose exactly why they worn in the first place. Because most people don't take an emery board to their teeth.
Okay.
They're doing this at night or during the day or when they're stressed, and it usually has to do with the bite and the way the teeth are coming together. And so you got to get that right, or else you just open up another can of worms.
Okay. Now you trained in cosmetic dentistry, I guess, at the most famous or prestigious cosmetic
LVI.
LVI, Las Vegas Institute.
Yeah,
I guess dentists from all over the world go there.
They do.
And you were an instructor there.
I was instructor there for a number of years. It's kind of like the Juilliard of dentistry.
Okay.
And we learn not only cosmetic principles, but more importantly, the thing of getting the bite right. Because when you have a bite that's off, that can not only cause your teeth to look old and flat and worn, but it can also give you jaw pain, headaches, TMJ issues, popping jaws, migraines. It can contribute to neck pain. If the bite's not correct, a lot of things aren't right. And so it's important to get that correct before you do anything with their front teeth, or else you're just going to break them off again.
Okay.
And then that's no fun.
Now your accreditation with the American Academy of Cosmetic Dentistry, I guess less than 1% of all dentists even have this.
Less than 0.01%.
Okay.
They're like 300 and something in the world. And it's one of these things that's just extremely challenging. Most people that start the process don't finish it. And basically you present your own cases, and you've got this thing where it's blown up 6 feet wide, and you've got the most picky people on the planet looking at this, trying to find anything wrong with it.
Judging your work.
Oh yeah.
Okay.
Oh, it's horrible. I mean, it's a tough process to go through, and not everybody makes it through. Fortunately, I was able to make that. In North Carolina, I think they're like 8 or 9 in North Carolina. The closest one is Charlotte. So as far as Western North Carolina, right now I'm the only one.
Okay. So cosmetic dentistry is like a discipline of dentistry?
It's not a ADA specialty, but people either do it or they don't. Well, everybody calls themselves a cosmetic dentistry because they might might have 2 shades of composite tooth colored filling material. But there's art and science with it. The science where you can do it and get the bite correct and that kind of stuff and have them not fall off in your soup. But the art of it is to make it fit their face so that the final result looks like they were born with beautiful teeth. Because nobody wants to look like, oh, I have veneers. No,
because I feel like I could spot veneers walking down the street. They're bigger and they can be bulky.
Yeah.
And the color doesn't look real to me either.
Mm-hmm.
Whose idea is that? Those big veneers? Is that the dentist, or is it the patient wants that?
Usually it's lack of experience and lack of communication with the dental lab. Because what we do is we use the provisional restorations, the temporaries, as a walking blueprint for the final one. Because a lot of people put the temporaries on and tell the lab make 6 pretty teeth, and then they put them in, you kind of get what you get. What we do is we go to a lot of trouble to make the temporaries look as close as possible to what we want the final one to look like.
So they get a temporary set of teeth that aren't quite the veneers yet.
Exactly.
So they get to try them out first.
You get
a test drive.
Yeah. If you're going to buy a really expensive dress, you're going to try it on.
Okay.
And so you get to see what it's going to look like before we finalize. It would bring you back after a couple of days. It's like, how do you like the way this looks? Too light, too dark, just right? How do you like the way there's your shape? Is the canines too pointy? Does it fit your face? Is there anything that you want different? I mean, you can't do that with a nose job. You know,
Okay.
you get what you get. With this, you can tweak it along the way, and I don't send the lab the final instructions until we've done that very important step to make sure that the final result is not going to be a surprise. Ask me how I know. I've been doing this a long time. So,
Okay.
and this, I do this all the time now, and that allows us to make sure that we get the final result that is exactly what we both want, the patient and me.
Are there that many people that really hate their teeth, hate their smile?
That's actually a lot of people do. And what it does, it holds them back. Because say when you walk in a room and you see your best friend there, what do you want to do? You want to flash them a big smile to tell them that you love them.
Okay.
If you don't feel confident about your smile, it's going to be, hi, nice to see you. And you're going to hold back. And you're not going to be as authentic as you are.
Like your
as you normally
charisma.
are.
You can't have charisma without smiling,
It's
right?
very difficult. And so having confidence to be able to flash a big smile, that's how people communicate. And so having that confidence is just incredibly important. And a lot of people aren't quite there. Even if it's just like one little tooth that's rotated or something like that, if it bugs them, it'll hold them back.
Okay.
And it'll keep them from smiling and being, basically being who they really want to be. And so, but then we can change that.
Are people that are coming in for like veneers or cosmetic dentistry, are they getting older and older or younger and younger?
I'd say older and older.
Okay.
But it's,
Like
it's
how
all,
old?
It's all,
I mean,
it's all over the map.
people in their 70s, 80s getting
I've
cosmetic
had people in
dentistry?
their 70s, 80s, redo their smile.
Okay.
Absolutely. It's never too late. For example, say if you only have 5 years left to live, make those 5 years the best that they can be. And having the self-confidence of a beautiful smile helps you do that.
Now, because you do a combination of procedures, like people could have missing teeth, you put implants, veneers, different things.
Yeah,
Is that right?
Yeah, absolutely. It's very, very common that we are doing the smile, but there's some missing teeth in there. We might place implants in those spots to fill in the gaps, as it were. But as far as, but a lot of the times we're actually doing upper and lower teeth and getting the bite correct.
Okay.
And so I got some cases I'll show you that are
All
just
right.
like
Yeah,
that.
you brought a stack of photos. So let's take a look at some of these.
Okay. Well, here's an example of just what we're talking about. This lady, the teeth made her look older than she is, and so
Okay.
they're kind of worn, kind of yellow. It's just she just wanted everything
Kind
to
of
be
flat.
spiffed up.
Flat
Yeah,
teeth
exactly.
we're talking about. Okay.
And so, what are our options? You can. What most people do is they do some whitening first. Let's just make them whiter and see what happens. And you can go to Walmart and get some Crest white strips. There's nothing wrong with that, and see if that makes you happy. If that does, that's great. But most of the time, when they're worn and chipped on the edges, that's not really going to do it. As far as options, sometimes people will put crowns on the teeth.
Okay.
Personally, if I have the option between a veneer and a crown, and I don't want to get too technical, it's a veneer every time because the tooth is stronger when we're done.
Okay.
If you put a crown on a tooth, you weaken the tooth. That's just the way it is. And so a veneer is much more conservative. You're removing a lot less of the tooth. The tooth is stronger when you're done. So I've had sometimes people come in and say, well, I have veneers on my teeth, so I can't eat corn on the cob or apples. Like, that's not true. They should be strong enough. You can
Okay.
eat whatever you want. Anything you can eat with teeth, you should be able to eat with porcelain veneers if they're properly done.
Okay.
Now, here's how she looks when we're done. She likes
Very
that a lot
nice.
better, much bigger smile. And she had, what's interesting about this lady is that her cousin is an LVI dentist as well in Florida. She lives, in North Carolina now, and she didn't want to travel back and forth. And so, her friend recommended us and say, well, let this guy take care of you. He'll do a good job. And so that's what we ended up with. But and knowing that her cousin is a cosmetic dentist as well, the pressure's on because I knew she was going to be checking it out.
Okay.
But I think the case turned out beautifully, and she loves it. Let me show you another one.
All right.
This is like we mentioned earlier, kind of a combination where it's a missing teeth and worn, teeth that are just showing their age, and there's wear, they're darkened, and so we wanted to brighten things up.
Is this like right up your alley? Like when
Oh.
you get a consult, you go, this is going to be good.
Oh, absolutely.
Okay.
And because I know what we can do. It's like there's a canvas, and I know that we can end up with a beautiful picture when we're done. And so sometimes I have to curb my enthusiasm a little bit because
Okay.
I know what we can do with this. This is great. So if I jump up and down a lot, it gets a little off-putting. So I got to watch that a bit. So what we did, we were able to place implants in some of the teeth and fix the front teeth with porcelain veneers. And wouldn't you say he looks a little better there?
Yes, he does. Looks very natural, too.
Smiling bigger because he wants to. And we can see that the way that the teeth, they don't look fake. They're shaped to fit his face. And every case is different. And sometimes, I see somebody presenting cases, all their crowns look alike. And so we want to make sure that it fits the individual, because, what I would do on you would be different on somebody else, on a young lady.
And it
so
also makes them look
you.
a little younger, because we talked about this in the green room.
Mm-hmm.
You say, teeth could actually make you look more educated, more sophisticated.
Yeah.
And in this case, I could see it, right?
Yeah, people always say that, one patient who is an actress, and once we did her smile, she got younger roles.
Okay.
Because, okay, well, you're not playing the grandmother anymore. Why don't you play the ingenue? So it's a lot more fun. She enjoyed that. I hope we have time for some more. Now, this young lady did not like her smile. And, like we said before, we put veneers on the front teeth. And because there's some old bonding here and there. A lot of times when we have old filling materials between the front teeth, it tends to look stained after a while and just looks shop worn. And so if you cover the whole part with porcelain, you can make it look however you want. And here's how she looks now. And
very nice.
And she's a very special person, because she's now a dentist working with us.
Is that right? So she's a dentist now.
Yeah, I did this before she joined us, over 10 years ago, and now she's with us. So we work together on many of these cases now, and it's wonderful.
And because she's gone through the process, it probably makes it
Yes.
better when she's talking with patients.
Yes, she's been there, and I've known her 15 years, so it's great. Speaking of wear on the teeth, this young lady had some significant wear on her front teeth. Her front teeth are about half the size that they should be.
Does she have like an underbite here in this photo?
When you wear the teeth, you can develop a bit of an underbite, so almost. It's kind of edge to edge right now. But we're able to fix that by adding porcelain, getting her bite correct, and adding porcelain to her lower. And so she looks, so much younger now. Now, one of the reasons why, not necessarily with her, why did people get all the wear? A common thing is acid reflux, which is very common. And because acid dissolves the teeth, you've got the enamel on the outside of the tooth. Once you get through the enamel, you're into the soft stuff, the dentin on the inside. It's kind of like an M&M with a crunchy outside with a chewy center. Once you get through the outside of the tooth, the wear really accelerates, and the wear gets much faster once you're through the enamel. And so it's like okay for a while, and then boom, the wear just picks off. Here's another one. This young lady is a dental hygienist. She works in the field, and it's hard to talk to patients about oral health if you don't like your own smile.
Okay.
Now, her former boyfriend told her one time, well, just don't smile so big so you don't see these black gaps around your teeth.
Wow.
And so over 20 years ago...
Couldn't she just do whitening?
No. Oh, she did. Oh, she'd whitened a zillion times. And
it just wouldn't respond to
some
whitening?
teeth just don't respond to whitening. Some teeth respond great. Some people just don't respond at all. Okay. And also, it doesn't change the shape of the teeth at all. If you've got the wear issue, it doesn't really help that much. And so this is what she looks like now.
Wow.
Much better. And I did mention that it was a former boyfriend, right?
Okay.
Saying that is not a good way to endear yourself. But we did her teeth over 20 years ago.
And this is like in one day, technically. I mean, in other words, there's a lot that goes beforehand, but in one afternoon, they walk out with teeth like this.
They walk out with the temporaries.
Okay.
And so, when you walk out, it's very close to what the final one's going to look like. And so that's when you start smiling big, and you get the emotional impact of what it's going to look like, because the temporaries look great. And so it's very, like I said, it's very important to make the temporaries look as close as possible to the final ones. So that's how we get there. Okay, I've got more. And speaking of people in the dental field, this young lady worked in dentistry for many years in Alaska. She's now a phenomenal glass artist, so she understands form and glass. And so she has some old veneers that had been done
very nice. Probably
15 years ago, and she just wanted to spiff things up in a lighter color and improve the look. And so also some more on the sides. A lot of times people when they smile, they get 6 front teeth and it kind of disappears there. And if you put some veneers on the teeth on the side, it sort of fills out, make a broader smile, like the Julia Roberts type smile, which everybody wants. And so we can do that with the veneers as well. And so just make sure that it fits their face. So you can see how the edges of the teeth follow the lower lip. Those are all conscious decisions while doing this, rather than just throwing in what the lab gives you. Okay, we've got more. I mentioned the bite. This lady not only has some worn, just doesn't like her teeth, kind of worn.
Those look like pretty good teeth. So when you're on the consult, what are you thinking? Like, how are you going to pick it up a notch?
Okay. Well, It would probably take longer than we have on this show to really explain all that, but I know we can make it dazzling. We can make it beautiful, and which we did. This is what it looks like now. Now, this is also a case where there was some jaw pain, there were some headaches, and actually she works with me, and I would walk by and I see her rubbing her face and like, what's going on? And my head hurts and my neck hurts. Okay, we got to fix that, and so we got her bite corrected. We did the porcelain, so if you get the bite correct, you can also have a beautiful smile at the same time. And so it's the best of both worlds. Not only you have a comfortable bite, many times it helps with headaches, with jaw pains, migraines, neck pains, popping and clicking in the jaw, the whole TMJ.
And that's your training, right, with this Las Vegas Institute?
That's what LVI teaches. And so that's how we fix it. And not only do you get the functional changes, but you get the cosmetic changes as well. So not only does it work better, it looks a lot better.
Yeah.
And so like I said, the best of both worlds. Here's another case. Different from the other one. This is just a pure cosmetic one. And especially for someone who's really young, there's something called no prep veneers. And so you can actually put veneers on top of the teeth as they are without preparing them at all.
If they're small enough?
If they have to look good if they're a little bit bigger.
Okay.
You can't do that on every case. Say if the teeth are very crowded, you can't do that. But for example, this young lady was 18 and happens to be my daughter, and really didn't want to prep her teeth, and her teeth was set up for that. So we actually did the thin porcelain veneers. It's just on top of what she had before.
But she goes, it's interesting, it's just teeth, but she goes from looking like just a kid to a woman with just the teeth.
If your teeth are kind of small, it can make you look at, because baby teeth are little. If your teeth are kind of small, it kind of we kind of think, oh, baby teeth, they're young or something like that. And when you're 18, you don't want to look that. You want to look older.
So you can't, as a dentist, have your daughter walking around with smaller teeth.
Of course not. Are you kidding? And a lot of these, the smile does, if you look at it, it really doesn't look horrible, but if they don't like it, that's the only thing that counts. And the same thing with this young lady, who's been our veterinarian for over 35 years. And so once we're done, we did her smile, and she sends in her partner, and we do his smile too.
Couples are doing this together.
It happens a lot. And so the husband coming in, or the wife will come in, and they'll send their spouse in, or sometimes they send their, or say, oh, now my mom has lost her dentures or something like that. So we get a lot of family dentistry as well. So which basically just shows that they trust us, which is wonderful.
Now look, flipping through your book on cosmetic dentistry, if people are just tuning in, he wrote the book on cosmetic dentistry. So how did they, this is my big question with veneers, how do they know what it's going to look like? Because I see you have like smile guides, and you have like education on, do they get to pick? How does that work?
We sometimes let them pick, but most of the time, most patients kind of let me run the show, because this is what I do.
But you do show them lots of photos of other smiles like theirs?
Yes, we show them a lot of pictures. And so when you're evaluating a cosmetic dentist, you want to see pictures of their work. A lot of times people have pictures on their walls, but they got them online. And so it's not necessarily their work. So you need to see what that doctor has done and what their cases look like. And a lot of them, because you're like, well, here's the case I did, and so okay,
so
show me 10 of those.
Is there more art? Because I know you're an artist, right? You're a photographer and things like that. But is there more art to veneers than science? Combination of both?
It's definitely a combination of both.
Because you taught cosmetic dentistry.
Yes.
So can you teach somebody that doesn't have that artistic talent?
You got to have a bit of an eye for it. And so as far as what looks good, you could do everything on a computer and but things tend to look a little artificial if it's just completely computer done, just like computer graphics. But a lot of it is like, well, if you do rotate this just a little bit, it's going to blend in better and just give it that little pop. And so there's a lot of art with it as well. The science is what keeps them from falling off. Okay. But the cosmetic part of it, that's what makes a lot more fun.
Is that the hardest thing to teach when you're teaching other dentists cosmetic dentistry?
Yes.
Is how to make it look just right?
Yes.
You have to be a perfectionist with this?
Oh, absolutely.
Time for a few more.
Okay. Here's another one where wasn't all that bad to begin with. Also some bite issues, some jaw pain, some headaches, something like that. She works in our office as well.
Wow.
And afterwards, now she loves her smile now. And so, she was beautiful before, but she's even more so now that she has this
It makes
smile.
people look a little more mature, a little more elegant.
Yeah.
Because going into this, and I told you, I feel like it's just teeth, but I guess it is more than that. It does change your appearance a little.
It's self-confidence. With all these cases and all the ones we've done, they feel better about themselves, and that's the only thing that really matters.
Okay.
If you got somebody where their self-confidence is fine, then then don't do this. But if it holds you back at all, when you're meeting somebody, do you ever just hide your smile? Do you ever do this kind of thing? If it holds you back at all, then you should look into doing
And
this.
many of these are kind of, in a way, quick fixes. Like
Yes.
small things can make a big difference.
Yes, it is.
Okay.
Kind of like on the Bill Dorfman's Extreme Makeover show. That's when they talked about those patients years after the show, the part that they appreciated the most was the dentistry.
I had the plastic surgeon, one of them, on my show right here.
Really?
And he
Yeah.
said, Randy, the biggest impact was their teeth and
Absolutely.
their ears. But he said the teeth made the difference. He goes, and I just have to tell you this, he said, you see people, they come in they take care of their hair, their nails, they've got the car, they've got a watch, fancy watch. So these people care about what other people think about them, but yet they have an old smile.
Yeah.
Is it the fear of the dentist that keeps people from doing this? What's your take on it?
A lot of it is fear, because they don't know what's possible, which is why we're sitting here, but also fear of what it's going to look like, which is why it's important to look at a lot of before and afters, make sure you get the confidence, that this doctor can do what you want. Also working with the temporaries as far as making sure that oh gee, I'm not sure I like that, so we can fix that on the way. But confidence in knowing that you're going to like the final result.
Now you have a slogan. Take a bite out of life.
Take a big bite out. We want you to take a big bite out of life.
You say it in your
Absolutely.
commercials, things like that. What does that
Absolutely.
mean to you?
It's kind of the way that I live my life, and I would like for people to do as well. Just taking action. Say, for example, let's say your smile is holding you back. Well, take action so that you can, take advantage of what life has to offer. As a friend of mine would say, life is a platter. You want to enjoy everything you can. And enjoy life, and go out there and do things, and take advantage of what life.
So if you don't like your smile, do something about it.
Do something about it. If it holds you back, if you don't like it, you can fix it.
Can you spot people, like you're walking around town, and could you spot people that don't like their smile, like that are hiding it?
They're not smiling.
Okay.
Most of the time, they're either looking down or smiling, or they may be slumped. It's kind of like what Tony Robbins talks about with your physiology and your psychology. If you're frowning all the time, what's that going to do to your brain? You're going to feel sad. You're going to feel depressed. If you're smiling, you can't feel depressed. And so your physiology and your psychology are extremely interlinked. And so if you're smiling, how sad can you be?
Okay,
So,
good point.
But if you don't feel good about your smile, you're not going to. So
Like it even changes their image, like they're now perceived as this happier person.
Yeah, and they tend to take better care of themselves. I have a young man who was a piercing artist before we did his teeth, and then he went to nursing school. He never would have done that before. And so
Is that what he told you?
Yes, absolutely. Also told me I was the only dentist he hadn't bitten after we were done, which is good.
That's funny.
But as far as people getting better jobs and things like that, and it definitely helps careers, it helps relationships, and it's the self-confidence. And
What's your opinion about this? I had a guy from LA. He goes, Randy, if you want to look your best into your 70s, because not everybody wants to look their best into their 70s, but if you do, veneers are inevitable because teeth age. I want to know what your opinion is on that.
Teeth get thinner, they wear down, and if you're using them, they do get smaller and they do get worn down. And so putting very conservative veneers on the teeth, not cutting the tool teeth down for a crown because I think that's too radical. A thin veneer actually will strengthen the tooth. So it's actually stronger than it was before.
Is that right?
As
Okay.
well as look better. So you've got some functional advantages as well as the confidence and the appearance
when you
advantage.
say functional advantage, it means the way you eat will improve.
Yeah.
The chewing capacity.
If you're doing this right, you need to pay attention to the way the bite and make sure the teeth fit together properly.
Some more photos.
Yeah. Okay. This young man had and you don't have to do the whole smile. Sometimes it's a small change that can make a difference in somebody's appearance. And so all we did is fill in the gap between his front teeth, and he's smiling a lot more than he did before. Now his wife told me that after we did this, she looked back and every picture that she could find of him, you couldn't see his teeth.
Is that
He
right?
did not smile for photographs ever. And she had no idea that this is what was holding him back. And now that we fixed the gap, guess what? Selfie city. He's just smiling for pictures all the time.
That's a simple fix for a dentist.
Yeah, that's not a big deal. And so
But for them, it's a big deal because they smile.
it's life changing. Even something as small as that, just fixing the gap, And that's all we did. That's all we're going to do. And he is a different guy as far as his self-confidence, which is great. Okay, we got time for more?
Yes, yes.
Take a look at this. There's some little cracks, old fillings that are stained. There's some wear on the edges of the teeth. She tried some whitening. It didn't really work. There's some rotations and things like that. She's also a competitive bodybuilder.
Okay.
And so when she's on stage, she needs to smile with confidence because you want her smile to look as good as the physique that she is, sculpted into shape, which is just amazing. And so now,
Very
when
nice.
she's on stage, she lights it up. And so all that stuff has changed. You have the uniformity. It's all one color. The rotations are gone. The edges are uniform. It fits her face. They're longer. And but the main thing is how she feels about it.
Is this the happiest group of patients?
Oh, they love it. Well, the implant patients are happy too. So that's why it's a wonderful profession, because we make people, we change people's lives and make them happier when we're done. Let me show you this next patient. Now, seems like all I have is performers. This young lady was a professional ballroom dancer. And her smile, like many of the other ones,
looking pretty good.
is not bad. She didn't like it. It wasn't up to the standards that she sets when she's dancing with these fancy dresses and all the amazing moves that she can do. And so what we did is did conservative veneers on her teeth, filled in the spaces, helped with the recession, and you can see how it, the edges, how it fits her lips, how it fits her face. They're not too big, they're not too small, and she's had a wonderful career in dancing, and she absolutely loves her. She's done with that, but she loves her smile.
Like with artists, they could see the end result. Can you usually always see the end result? Like they're on a consult, they're giving you their hard luck story, but in your mind, are you going, boy, this is going to be good?
Yeah. Early in my career, not as much, but now after doing this for over 35 years, it's like, oh, we can fix this, it's just the way it works.
The public doesn't know the difference between a regular dentist and a cosmetic dentist, because anybody could call themselves a cosmetic dentist.
And they do, yes.
Okay.
But it's experience, and also, for example, like the AECD accreditation, having demonstrated to a third party that this person can do what they say they can do.
So what do? You ask your dentist, are you involved in the American Academy of Cosmetic Dentistry? Because if they're not, chances are what? They're not that into it?
That would be a good start.
Okay.
But basically, like I said, seeing photographs before and after pictures of their work, and get picky.
Final message: somebody watching this doesn't like their teeth, but for some reason they can't get themselves to go to the dentist. What do you say to them?
Come in, let us take a look. We can give you an idea of what we can do for you, and here's the options. It's your mouth. Tell us what you want to do. But if it's holding you back, you can do something about it. And why not?
But what if you have bad gums? Can you get veneers or no?
Oh yeah, but you got to get that taken. We can get that taken care of for you. But we have to
clean those up.
Yes, you have to have a healthy foundation for anything, and so that's part of the whole.
Okay.
That's part of the whole deal.
And gummy smiles, things like that. Are these things you take care of also?
There are ways to fix all that stuff.
Okay, good. All right, I want to thank you for coming on the show. Good stuff.
Thank you much.
And
Glad to be here.
they can even do a virtual consult.
Yes,
They can sign up for that online.
Online, you can get a personalized video from me, letting them know kind of what their options are.
Okay, good.
Very easy.
All right, thanks for coming on the program.
Thank you, sir.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.